Welcome. Today, we're looking at something pretty special, a highly exclusive, strictly confidential explainer covering a rare, turnkey, primary care acquisition opportunity. Listen, if you're in the market to acquire a robust, established medical practice where the massive foundational work is already done and totally de-risked, well, you're definitely going to want to pay close attention to this one. Let's jump right in. Okay, let's get into the details. What we've got here is a fully established, single-site primary care operation. Everything is consolidated under one roof. But here's the kicker, and this is what makes it so incredibly unique. The current owners actually operate this practice entirely absentee. They live totally out of state and just manage it remotely. So think about what that means. For a hands-on owner-operator, or maybe an expanding medical group, this presents a massive, immediate upside. You'd be stepping into this incredibly clean, unified operation that is just primed to capture all that organic growth that simply hasn't been chased by the remote ownership.
Now let's talk about exactly who you'd be serving, because you are stepping right into a massive demographic tailwind here. The patient base includes exactly 1,457 senior lives. That means patients age 65 and older make up 43% of the entire panel. Basically, for an ambitious operator, this is the golden ticket. It is literally the perfect foundation for expanding chronic care management, driving those value-based care initiatives, and really capturing those higher acuity Medicare opportunities.
So the crucial point here really comes down to the sheer scale and, honestly, the loyalty of this roster. We're talking about a patient base of well over 3,000 active patients. And I want to be clear, this isn't just some stale list of names. Actually, roughly 90% of this entire panel is highly retained and actively engaged. They're coming in. That means they're providing a reliable, recurring base of continuing visit volume for you right from day one.
And that amazing loyalty, well, it translates directly into exceptional payer quality and real revenue stability. A remarkable 61% of this patient base is on high reimbursing commercial insurance. Plus, that's backed up by a super strong traditional Medicare and Medicare Advantage foundation. Crucially, though, your risk is spread out across over 100 distinct health plans, and the Medicaid exposure is incredibly minimal. Ultimately, that just means your cash flow is diversified, it's predictable, and it's super high quality.
Okay, let's look at the growth levers, because there are a lot of them. You're walking into a fully equipped, completely turnkey clinical space that's already running smoothly on a proven electronic medical record system. And remember, because the current owners have been completely absentee, a more engaged buyer could instantly drive organic growth. I mean, you could just expand provider hours, add in that chronic care management we just talked about, or even introduce brand new ancillary services. It's wide open. Oh, and to make the transition incredibly smooth, highly attractive seller financing is actually available to qualified buyers, which heavily de-risks the entire acquisition.
Honestly, opportunities to acquire a de-risked, turnkey practice with this much untapped potential, they're incredibly rare. The foundation is there, it's just waiting for someone to step in and unlock its full value. So, interested in learning more? Scan the QR code to access additional information and explore this confidential acquisition opportunity with strategic medical brokers.